getting hit in the nuts hurts. It's very likely, if you own a pair of testicles, that you've been hit in them at some point in your life. Do you remember what that feels like? Now imagine walking around every day with that sensation. I'm Dr. Luke Bynum. I'm the founder and lead instructor of United Dry Needling Education, but I'm also a men's health physical therapist that specializes in treating all kinds of pelvic floor dysfunction in men, including testicular pain. Some testicular pain comes from the actual testicles, but a lot of testicular pain is referred from other areas, including muscles. This video will educate you on some of the muscles that refer pain into your testicles. If your testicles hurt, it's pretty safe to say that you're probably miserable. Addressing some of the muscular causes of your testicular pain can greatly improve your quality of life. When we think about testicular pain, we're going to place it in two separate categories. So we'll look at the causes of testicular pain that occurs within the scrotum, and then causes of testicular pain that occur outside the scrotum. And those causes are typically referred down into the scrotum. Epididymitis is a common cause of testicular pain. Epididymitis is the inflammation of the coiled tube at the back of the testicle. A hydrocele is a collection of fluid around the testicle. They are very common. A lot of people walk around with hydroceles and they have no idea that they have hydroceles. When I do a testicular ultrasound, when I'm doing an evaluation on a patient, a lot of times I'll just find incidentally a hydrocele, and it's not necessarily problematic. However, sometimes it can become painful. Orchitis is simply a swollen testicle. Now, a swollen testicle can happen for a lot of reasons. Some of those reasons can be systemic, so it can be like an infection that's causing your testicle to swell, but also you can have trauma that creates swelling into your testicle. Certainly, most of the people that are walking around with testicles have at some point in their life been hit in the testicles. And so if you get hit hard enough, it can actually cause your testicle to swell, and that will certainly create a lot of pain. A scrotal mass can be painful. Just feeling something that's abnormal on your testicle itself. Those can be cancerous and those can be non-cancerous. You just have to get some imaging or some type of testing performed by your urologist to determine what that mass actually is. Sometimes masses can be non-painful, regardless of whether it hurts or whether it doesn't hurt. If you feel a mass on your testicle, you need to get that evaluated to determine that it's not anything more sinister, like a type of testicular cancer. Spermatoceles are another potential cause of testicular pain. A spermatocele is a fluid-filled cyst within the epididymis. You could also develop a testicular torsion. What that is it's a twisted testicle. So if your testicle twists, it's going to affect the blood supply. Testicular torsions are going to be incredibly painful. You will be sick, you will be miserable, you'll be likely have nausea, vomiting, and just have intractable pain in your testicle, and it'll likely send you to the emergency room. There are some rare cases in the literature of testicular torsions that have been non-painful, but again, that is pretty exceedingly rare. A varicocele is another very, very common cause of testicular pain. What a varicocele is an entanglement and enlargement of veins surrounding your testicle within your scrotum. So basically, the veins at the top part of your testicle will get entangled and they'll start to swell. And what it feels like is a sack of worms. So in your scrotum, you can actually touch and feel what feels like a bunch of worms above your testicle. And they're swollen, and a lot of times they're painful. A lot of times patients will describe it feels like they have a headache in their scrotum. And oftentimes that's very commonly a varicocele. Regardless of the cause of testicular pain within your scrotum, most likely you're going to feel something abnormal in your scrotum, and it's going to let you know that, hey, something's going on here besides just pain and I need to get this evaluated. That's not always the case, but oftentimes you will feel something abnormal in your scrotum. Now we'll consider causes of testicular pain that occur outside of the scrotum, but refer pain down into the testicles. Diabetic neuropathy is one of the systemic conditions that can cause your testicles to hurt. An inguinal hernia is a condition that can cause testicular pain. I've had patients tell me that they basically, quote, woke up with a third nut. What happens with an inguinal hernia is part of your intestine slides through your inguinal ring, and then it'll go down into your scrotum, and it potentially will feel like a third testicle down into your scrotum. Now, again, this is a piece of intestine, but it can cause pain into your scrotum. One of the definitive fixes for an inguinal hernia is to have it surgically repaired. They can do this laparoscopically or they can do this robotically, and sometimes they do it as an open procedure as well. Unfortunately, sometimes you will get testicular pain after you have that robotic or that laparoscopic or even an open hernia repair in this region. There's some very interesting things that can occur during a hernia repair surgery. And kind of one of the adverse events that can happen during an inguinal hernia repair surgery is an injury to some of the nerves along that region. You can have an injury to your genitofemoral nerve, you can have an injury to your iliohypogastric or your ilioinguinal nerve, and all these nerves can refer pain down into your testicle. You'll have a burning, searing sensation that kind of radiates through your groin and then down into your testicle. And a lot of times that'll happen after you have a inguinal hernia repair. And I've had several patients that present with their primary complaint of testicular pain, with a burning, radiating pain into the testicle. And then once I start delving into their history, I realize that they've had an inguinal hernia repair. And oftentimes that is kind of what launched their testicular pain. Some other systemic causes of testicular pain, so pain that happens outside of your actual scrotum, would be something like a kidney stone, also urinary tract infections, and then also sexually transmitted infections or sexually transmitted diseases can all create testicular pain. Prostatitis, by definition, is an inflammation of your prostate. But there are a lot of different types of prostatitis. Some of those are infectious, some of those are inflammatory, and there's a type of prostatitis that has absolutely nothing to do with your prostate. That type of prostatitis is prostatitis type 3, and that's chronic pelvic pain syndrome, which actually, again, doesn't have anything to do with your prostate. It's more associated with all the muscles and myofascia surrounding the pelvic floor, and then it creates chronic pelvic pain. And that pelvic pain can refer straight down into your testicles. And so a lot of times when I get a patient diagnosed with prostatitis, they don't have a true infection of their prostate. They don't have a true inflammation of their prostate. They're having this chronic pelvic pain that is, again, diagnosed as chronic prostatitis type 3, and it just manifests itself as pain in their pelvis or pain into their testicles. Which leads us to our last cause of testicular pain that happens outside the scrotum, and that's just referred muscle pain. So pain in a variety of muscles that just refer and radiate straight down into your testicles. So for most of these causes of testicular pain that occur outside the scrotum, generally you won't feel something abnormal in your scrotum. You won't feel something abnormal with your testicles. One notable exception to that would be an inguinal hernia, because you actually usually will feel something in your scrotum. And again, as I have patients tell me, it feels like a third nut, which is just a piece of your intestine that slipped through the inguinal ring and has gone down into your scrotum. And now, for the whole purpose of this video, what are some of the muscles that can cause or contribute to testicular pain? So believe it or not, your butt muscles, your gluteal muscles, specifically the gluteus maximus, can refer pain into your testicle. According to these researchers, the typical referred pain and resulting symptoms for the glute max include pain local to the buttocks, superior to the sacrum, and inferior to the uppermost ipsilateral posterior thigh. You can also have sitting bone pain, pain in your perineum, and then iliosacral pain as well. And then look, testicular pain. So your gluteal muscles can absolutely cause and contribute to testicular pain. And then your glute max can also give you pain in your hamstrings and then pain in your sacrum as well. The gluteus maximus is not alone in the gluteal muscles that can refer pain into the testicle. So if you peel the layer of the gluteus maximus off, the next layer down underneath is the gluteus medius. So again, the same researchers describe some of the typical referred pain and resulting symptoms for the gluteus medius. That includes pain at the posterior crest of the ipsilateral ilium, the sacrum, posterior lateral ipsilateral buttock, and the upper thigh. Glute med pain can also give you pain with walking, laying on your back, so supine lying, ipsilateral side lying, and then if you sit in a slump position, it can generate pain as well. Gluteus medius can give you SI joint pain or also back pain, and then just like a gluteus maximus, gluteus medius can give you testicular pain as well, along with pain in the hamstrings and then pain in the sacrum. If you're still watching at this point, I hope this video is helping you and you're actually learning something. However, I do have one request. Please hit the subscribe button. It helps out a whole bunch. There are 3 gluteal muscles. You have your gluteus maximus, your gluteus medius, and your gluteus minimus. So your gluteus minimus is the deepest layer. So if you peel off the gluteus maximus, and if you look underneath that, you have your gluteus medius. If you peel off your gluteus medius, you look underneath that, and then you have your gluteus minimus. So just like the max and just like the med, glute min can also give you pain in your testicle. So the typical referred pain and resulting symptoms for gluteus minimus include pain at the lower lateral buttocks, the lateral thigh, the knee down into the ankle, and then also your posterior thigh. It can give you pain with a sit to stand motion, and then just like the med and just like the max, it can give you testicular pain, and it can also give you pain in the hamstrings and pain in the sacrum as well. Anytime you're evaluating a patient with any type of testicular pain, you've got to look into the gluteal muscles, because all 3 of the gluteal muscles can generate, create, and contribute to testicular pain. So we looked at the gluteal muscles and how they can contribute to or cause testicular pain. Now we're going to look at a muscle in the abdomen. So this is the external oblique, so the external abdominal oblique. Lots of testicular issues are driven from the abdomen, specifically in the external oblique and specifically into the internal oblique. So again, according to these research, the typical referred pain and resulting symptoms for the external abdominal oblique include heartburn symptoms. It can give you groin pain, and then this muscle can also give you genital pain. This muscle can also give you belly pain, it can give you inguinal pain, and then, most importantly, it can give you testicular pain. And according to these researchers, this is often a cause of testicular pain that is frequently overlooked. I will say, in the majority of patients that I treat for testicular pain, I am always addressing their abdomen, so addressing their external abdominal oblique and their internal abdominal oblique. This is a frequent area where I use ultrasound guided dry needling to address this muscle under ultrasound guidance to make sure that I don't puncture too far past the muscle and go into the peritoneum and create an adverse event with the needle. But I frequently do dry needling on the external abdominal oblique and the internal abdominal oblique as well when I'm treating patients that have testicular pain. Directly underneath the external abdominal oblique is the internal abdominal oblique. So if you peel off the external oblique, then you're looking at the internal oblique. Some of the symptoms and the pain referral for internal abdominal oblique include heartburn symptoms and epigastric pain, upper and lower abdominal discomfort, lower abdominal pain, and then stomach discomfort and belly pain as well. This muscle can also give you inguinal pain, it can give you groin pain, and then importantly, it can give you testicular pain as well. Another interesting thing about this muscle is between the layer of the internal abdominal oblique and the transverse abdominis, there are two nerves that live there. You have your iliohypogastric and then your ilioinguinal nerve. Now, either one of these nerves can become entrapped in between those two muscles or they can get irritated. And these are also susceptible to being damaged when you have an inguinal hernia repair surgery. Any damage to these nerves, irritation of these nerves, can create kind of a burning sensation that can radiate down toward your testicle. Your genitofemoral nerve tends to give you more of the testicular burning pain, but your iliohypogastric, ilioinguinal can contribute to it as well. We can't talk about pelvic pain, testicular pain, or any type of just general groin pain without talking about the adductor muscles. So these adductor muscles, they get tight and they get angry. And, just think about it for a minute. If your testicles are hurting, you're going to tense up, you're going to be tight, and you're going to be, irritated. And so when you're tensed up, you tend to kind of keep your legs closed together. So these little adductor muscles are the muscles that help keep your legs closed together. So they get very angry, they get very tight, and they can create a lot of pain. I doubt I see anybody for any type of pelvic floor dysfunction that doesn't have tight adductor muscles. So we're always addressing the adductor muscles when we're treating pelvic floor dysfunction. For the adductor muscles, I'm referring to them as a group. So you have the adductor longus, you have the adductor brevis, you have the adductor magnus, and I'm also including the pectineus in when I'm referring to the adductor group. According to these researchers, the typical referred pain and resulting symptoms for the adductor muscle groups include deep pelvic pain, also groin pain that can radiate into your testicles, give you medial thigh pain, knee and shin pain, and then basically tenderness in any of the referred pain zones or your pelvis. I think it's important to notice where these adductor muscles kind of start, so where they originate from. If you look at the screen there, you can see the blue muscle where it starts, and then it inserts on the mid part of the femur bone there, but it starts at your pubis. So at your ischiopubic ramus, or actually at your pubic symphysis. So that's actually where your genitalia is. So these muscles are basically pulling from that base of your genitalia when they're too tight. I just gave you all that good information about how these muscles may be causing or contributing to your testicular pain. But now you may be wondering, well, what are my next steps? What should I do about these muscles that are potentially causing my pain? I think it's important to understand that these are muscles, just like all the other muscles in your body. They're just in a different location. So, I can't give you direct treatment recommendations without first evaluating you and performing a thorough physical examination on you. But I will say that sometimes there is a beautiful simplicity to addressing muscular pain. If the muscles are tight, you try to loosen them up. If the muscles are weak, you try to strengthen them. If the muscles are sore, you try to massage them and help reduce their pain. Most importantly, you need to seek evaluation from a medical provider or a urologist to rule out the organic causes of your pain. Once those have been ruled out, seeking help from a clinician, like a physical therapist that specializes in male pelvic health dysfunction, is the logical next step. They can assess for any weaknesses or tightness, and then they can perform any manual therapy techniques to address your painful muscles. When I evaluate a new patient with some type of pain or pelvic floor dysfunction, it involves a thorough physical examination and a thorough conversation about their pain and the things that are causing their pain and the things that are causing their symptoms. The actual physical examination includes an assessment of both pelvic floor and non-pelvic floor muscles that could be contributing to their symptoms. A large part of assessing muscles is to actually touch them to see if it produces pain. Unfortunately, you can't touch all the muscles of the pelvic floor externally, so oftentimes I have to conduct an internal examination. For an individual with male anatomy, the only entrance to assess these muscles is through the rectum. But if you've ever been to the urologist, you've probably already experienced a rectal exam.
I kind of jokingly tell patients a finger in the rectum is pretty much the price of admission to be able to see a urologist. The bottom line is it's just so important to seek help from someone with the proper training that can evaluate all the possible causes of your pain. There's just no reason to walk around hurting all the time.